A Pritzker briefing with a new look. The governor today at his home in Chicago, as is his staff, after a senior aide tested positive for COVID-19.
And I want to assure everyone that the governor's office is very much still in full operation, and all aspects of the executive branch will function as they have been.
The name of the senior staffer was not disclosed, but we're told was not displaying any symptoms of the virus.
We've identified all this person's contacts, and just like the contact tracing protocols call for, there's no release of the name of the person who was found to have COVID-19, but all of their contacts are notified that that person had COVID-19.
Also announced today, the state getting a new shipment of the drug remdesivir on Saturday. 140 cases of the drug distributed to 14 hospitals around the state. That is enough to treat about 5 patients.
It was distributed to hospitals that have seen the most critically ill COVID-19 patients. We also included safety net hospitals and hospitals treating large communities of color.
Also today, the governor announcing a new outlook for a virus peak, moving it from mid-May to now mid-June, saying most regions are on track to move to a less restrictive phase by May 29th, except for the Northeast region, including Chicago, which still has a testing positivity rate of 22.3%. That is far higher than the other regions are reporting. And in order to move to a new phase, a region must have a rate of less than 20% for 28 days.
Lifting all of our mitigations at the end of May would likely lead to a second wave of outbreak in each and every one of our 4 regions.
This as Republican state lawmakers are asking the governor to reconsider his plan and reopen the state faster.
It is true that I'm talking to people in various industries and listening to their ideas, most especially for when things open, how to do that most safely.
The state is also looking to hire a number of people to work in contact tracing. You heard the governor just talk about that. That is to find people who may have had contact with a COVID positive patient and let that person know.